avid runner, weightlifter, weekend warrior, or maybe you're someone in between that just now started their fitness journey, and maybe you've noticed that you've been dealing with a little bit of knee pain, specifically in the front of your knee, whether that's just above your kneecap or just below your kneecap. And we understand how frustrating that can be, especially when you want to keep doing the thing that you love. And maybe you've tried resting it, you've tried icing, you've tried heating, maybe you've even tried some rehab that you found online, and nothing seems to be working. That is commonly referred to as runner's knee or jumper's knee. The medical term for it is a tendinopathy, and really it's just an overuse of those tissues. My name is Dr. Emily Rains. I'm one of the providers here at Restore Chiropractic and Rehab, and what I would like to do is explain to you what a tendinopathy is, or AKA runner's knee or jumper's knee, how we evaluate it in the office, how we treat it, and even give you some rehab exercises that you can start today to hopefully get you back to doing what you love. So what is knee tendinopathy or runner's knee or jumper's knee? Those terms are just fancy terms for the fact that your knee is angry or inflamed, specifically those tendons that run from your quad muscle to your kneecap, or right below your kneecap too, or your patellar tendon. Those tendons get so angry and they don't know how to respond to load anymore. And so what we like to do in the office when we're talking about tendinopathy is talk about it like a load tolerance or intolerance issue. Maybe you were lifting and everything felt fine, and then you jumped a lot of weight really quickly. What can happen is that tissue is designed to have some micro trauma to it so that it can rebuild. But if it gets too much and it can't recover, that's when we get what's called a tendinopathy or a runner's knee or a jumper's knee. So how do we evaluate knee tendinopathy or runner's knee in the office? Oftentimes what we're looking at is how is the person moving as a whole. So we're not just looking at the knee. We're going to look at how is this person functionally moving? How are they squatting? How is their single leg squat? How is their lunge? We're looking at ankle mobility, and we're also, like I said, just looking at the overall function of the entire unit. Because oftentimes what happens, especially when we're looking at that knee, it's not necessarily a knee issue. Oftentimes what we're seeing is it's actually coming from weakness in the hip, or it's coming from a combination of weakness in the hip and that ankle is not moving the way that it should. So when we evaluate in the office, we're really trying to look at everything as a whole picture. Or how are you moving in your lift that maybe is causing that problem? Or how many miles are you running? Or what does your stride look like? All of that stuff matters, especially when you're talking about the knee being the issue, especially because it's sandwiched in between two really important joints. How are we treating knee tendinopathy or patellar tendonitis or runner's knee in the office? Oftentimes what we're doing is we're taking that evaluation piece that we went over previously and we're putting it into our treatment plan. Here at Restore Chiropractic and Rehab, we use a lot of different modalities for that reason, because no one person is the same. A runner's treatment plan is going to look different than someone who's been weightlifting for years versus someone who just started versus a youth athlete. All of that stuff is going to look different. And so for that reason, we have a lot of things that we like to do and like to incorporate based on how that person is responding. Here at Restore, we use Graston or scraping or instrument-assisted soft tissue mobilization. We use cupping, we use dry needling. We also have a red light laser. We have shockwave. We also add in a lot of functional rehab with that as well. And then we also do adjustments if necessary. So we have all of these things that we can use so that we're making sure we're hitting each piece of the puzzle. So like I said, knee tendinopathy can be really frustrating because it is an overuse issue, but a lot of the times what we're looking at is how do we deload you appropriately so that we can reload you and then use all of the tools that we have in our toolbox to aid in that recovery as well. Ultimately, our goal at the end of treatment is to make sure that, one, this issue is getting better, two, we're giving you the tools and the knowledge to hopefully self-manage and treat on your own if you need to, but also we want to make sure that you're getting back to doing what you love and that this doesn't become a long-term issue. Tendinopathy can become a long-term issue if it's not addressed correctly, and that's not something that we want for our weekend warriors, our runners, our youth athletes. Like, we want them to be healthy and we want them to be able to continue to compete and do the thing that they love. Here are 2 exercises that can get you started on your journey to recovery today. Starting with the Peterson step down, we're going to stand sideways on a step with the affected leg on the step. Lower your other leg down to the floor by bending the stance leg slowly at the knee and hinging at your hips. When that hanging leg touches the ground, squeeze your glute to stand back up. We don't want to let that knee fall inward, and instead we want to make sure that we're pushing that knee laterally to keep the knee in line with the toes. With a circular band around the midfoot, we're going to create tension by getting in an athletic stance, feet shoulder width apart, and take lateral steps back and forth, leading with the heel, keeping the toes pointed forward. We're going to transition the band up to the ankles and take a diagonal step back, driving that heel into the ground, and again, creating that tension and making sure that those knees stay outward and don't collapse in. We're going to then move the band to just below the knee, get in an athletic stance, creating that tension again, and laterally stepping, leading with the heel, keeping the toes pointed forward. Then we're going to move that band just up above the knees, keeping that toe on the ground and driving those knees outward, but maintaining control while coming in to not let that knee collapse.